An exclusive News Channel 5 investigation into Tennessee's broken mental health system reveals cries for help that often go unanswered. Good evening, I'm Rory Johnston.
And I'm Hunter Hoagland. Even people who can afford to pay are often forced out of psychiatric hospitals. Investigative reporter Ben Hall obtained new data on what happens after people are involuntarily committed.
People are involuntarily committed in a psychiatric hospital when they are suicidal, deemed a threat to themselves or others. They are not criminals, but people in crisis, and our system is failing them.
All rise.
It happens every Wednesday and Friday inside the Davidson County Courthouse.
Can you explain to the court?
A judge hears from doctors and patients about whether to commit people to a psychiatric hospital.
We're seeing a lot more cases than I saw when I started.
Presiding Judge Melissa Blackburn was elected 9 years ago and says mental health cases have soared.
It's definitely a crisis. There's no question about that.
Since 2019, more than 23,000 people in Davidson County have been ordered by a judge into a psychiatric hospital against their will. It usually starts in an emergency room where people go when they're suicidal or in a mental health crisis. They then go to an available psychiatric hospital. A judge later decides how long they stay.
And then we make a determination based on what they say and what the doctor says as to what we feel is best for that patient's safety.
But judges started noticing they were seeing many of the same people over and over. Judge Blackburn's office put together this spreadsheet showing the county's repeat involuntary hospitalizations.
This system is broken. We've got to fix it.
The data showed over a recent 4-year period, numerous people committed 20 times or more. It also showed they often went to different psychiatric hospitals each time, and those hospitals were not communicating about the patient's history.
No one's checking. No one's paying any attention. No one's bothering to see where they've been or what they've been on or what the prior medication is. Hence them going from hospital to hospital to hospital.
Take Natalie, not her real name. She was hospitalized 39 different times and went to 5 different psychiatric hospitals.
If they would communicate, they could hopefully cut down dramatically on the number of times Natalie is being hospitalized.
39-year-old Patricia was hospitalized 26 different times. She's even been to jail 4 times. Blackburn says each hospital sent her home after just getting her out of immediate crisis.
She's home for a week, week and a half, and something happens again. She's readmitted through an emergency room at a different hospital, and we start over.
You cannot always get help unless you are a danger to yourself or others. That's stage 4 in any other medical condition.
Robin Nobling with Davidson County's National Alliance on Mental Illness says once someone gets out, there is not enough follow-up care.
They used to go to their homes and check on them. I remember case management would make sure that they were picking up their prescriptions.
She says if follow-up is done at all, it's done by phone.
We have a mental health system that says, call me when you're sick. We don't have a mental health system based in recovery.
The data also shows people who've been jailed multiple times. 41-year-old Cameron was jailed 24 times for low-level crimes. He also was committed 8 times at 4 different county hospitals. And 33-year-old Kane, jailed 7 times, but was committed 28 different times at 4 different hospitals.
There's no reason for that happening. Somebody is not bothering to take the time to figure out what's really wrong with him and to get him on the right medication.
Judge Blackburn is now telling doctors where a person has been treated before when they testify in committal cases. She's hoping to reverse the revolving door of committal and release by requiring more communication. Judge Blackburn says there is a desperate need for more psychiatric hospital beds that are fully staffed. We're going to stay on this issue, but the bottom line, we're seeing more and more severe cases, and experts say more needs to be done to help them.
Ben, thank you. By the way, the state says it's working to make mental health resources easier to access by adding new information to its MyTN app. That app includes information for the statewide crisis line and the Tennessee Red Line, which helps people who are battling either substance abuse or addiction. By the way, the MyTN app is free and it's available right now in your app store.